Chapter 29, Treatment of Bacterial Infections. Antimicrobial agents, also called antibiotics or anti-infectives, play a key role in improving the survival of individuals with bacterial infections, but do not treat viral infections. Technically, an antibiotic is a naturally occurring substance that is produced by or derived from a microorganism and is able to destroy or inhibit the growth of another microorganism. A drug factor that can influence how quickly a patient begins to feel better after starting pharmacotherapy is whether the anti-infective is bactericidal or bacteriostatic. Bactericidal agents like penicillins are able to destroy rapidly proliferating bacteria. Patients may begin to feel better within the first 24 hours. Bacteriostatic agents like tetracycline slow the growth of bacteria enough for the host, our body's defense mechanism, to destroy the invading bacteria. Take up to 3 days before you feel better. Anti-infective agents work by a variety of mechanisms of action, such as inhibiting bacterial wall synthesis, inhibiting cell wall function, inhibiting protein synthesis, inhibiting bacterial deoxyribonucleic acid or ribonucleic acid, and inhibiting folic acid. Many bacteria have a cell wall that is the target of some antibacterial agents. Because human cells lack cell walls, antibacterial agents that target the cell wall harm the bacteria without damaging the human host. Penicillins, cephalosporins, carbapenems, and monobactams are bead-lactam antibiotics that inhibit cell wall synthesis. Glycopeptides also target the bacterial cell wall. Vancomycin is the only glycopeptide antibiotic available in the US. Aminoglycosides, macrolides, tetracyclines, amphenicols, and oxazolidinone are classes of antibacterial agents that inhibit the formation of the protein bacteria needs to replicate. Genetic code is stored in DNA. In the replication process, a strand of RNA forms along a strand of DNA. RNA regulates specific cell functions, such as editing strands of code. Without the ability to transfer the genetic code for the synthesis of bacteria cell constituents, bacteria are unable to replicate and spread. Fluoroquinolones and nitroimidazoles are classes of antibiotics capable of inhibiting DNA synthesis. Fluoroquinolones and nitroimidazoles are predominantly bactericidal. Rifampin inhibits bacterial RNA synthesis. Folic acid is needed for the bacteria to synthesize DNA because, unlike humans, they cannot get it from external sources. Microbes spread rapidly, mutate frequently, and adapt with relative ease to new environments and hosts. Unfortunately, microbes can learn how to withstand the effects of antibiotics. Superbugs are resistant to currently available antimicrobial agents. Multi-drug resistance is a serious problem, and although previously only a risk for hospital patients, multi-drug resistant tuberculosis, vancomycin resistant enterococci, and methicillin-resistant staphylococcus, like MRSA, are spreading outside of hospitals. Microbial resistance is the ability of bacteria to overcome the bactericidal effects of an antibiotic. Bacteria may overcome the effects of anti-infective agents by secreting an enzyme that inactivates the B-lactam antibiotics like amoxicillin. There are 3 B-lactamase inhibitors: clavulanic acid, clavulanate, sulbactam, and tazobactam. Macrolide antibiotics are inactivated by bacterial production of enzymes. Bacteria resistant to one penicillin antibiotic may also be resistant to most penicillins and other B-lactams, including cephalosporins. Misuse of antimicrobial agents is a major cause for the development and spread of microbial resistance. Misuse includes the following: 1, inappropriate prescribing, meaning you didn't need the antibiotic or it was not the right antibiotic prescribed. 2, failure to complete the full course of therapy, which is a very, very common occurrence. You start feeling better, so you stop taking it or you forget to take it. That can lead to microbial resistance. Administration of antibacterial agents for viral infections, like the common cold. So again, you didn't need an antibiotic, you had a common cold, it would have taken care of it self-limiting on its own. But the doctor went ahead and prescribed it for you anyways. That is a major cause of microbial resistance. Antibiotics in the food chain. And 5, lack of guidelines for preventing the spread of infections in institutional care settings. Aminoglycoside anti-infectives are effective for treating serious infections of the bone, abdomen, heart, brain, urinary tract, reproductive system, skin, and kidneys caused by bacteria that are sensitive to their antimicrobial effects. Aminoglycoside may be administered to sterilize the bowel prior to bowel surgery. Ophthalmic dosage forms are also prescribed for the treatment of blepharitis and conjunctivitis. Aminoglycosides inhibit bacterial protein synthesis. They are not absorbed systemically when administered by mouth. The only aminoglycoside that is administered orally, neomycin, is used to reduce the bacteria in the bowel prior to colorectal surgery. So we have our chart of aminoglycosides and all of the different dosage forms and strengths. Cephalosporins have a B-lactam ring structure. Like penicillins, the different side chains added to the basic B-lactam ring structure can affect the antimicrobial spectrum of activity. They are classified as first, second, third, and fourth generation cephalosporins. First generation cephalosporins are most effective against staphylococcal infections and streptococcal infections of the skin and soft tissue caused by gram-positive aerobic bacteria. Gram stain is a process used to identify types of bacteria. A crystal violet stain is applied to a sample taken from the site of infection. When the stain is washed out, gram-positive bacteria retains a dark purple color. Gram-negative bacteria retains a pink color. Second generation cephalosporins are effective for treating upper respiratory infections caused by gram-positive and gram-negative bacteria. Third generation cephalosporins are used to treat bacterial meningitis, gonorrhea, intra-abdominal infections, bone and joint infections caused by gram-negative anaerobic bacteria. The fourth generation cephalosporin, cefepimine, is administered to treat pneumonia, community acquired and non-scomial and urinary tract infections. A common beginning for cephalosporin drugs is CEF or CEF. Cephalosporins inhibit the third and final stage of the bacterial wall synthesis by binding to specific penicillin binding proteins located inside the bacterial cell wall. Cephalosporins are formulated for oral, intramuscular, and intravenous use. Cefiximine is the only third generation cephalosporin that is administered orally. In contrast, all but 2 second generation cephalosporins are available for oral use. First generation cephalosporins do not penetrate the cerebrospinal fluid in adequate concentration to treat meningitis, whereas most third generation agents reach a high enough level. The fourth generation agent has a greater ability to penetrate the bacterial cell wall of gram-negative bacteria than third generation agent and is more resistant to destruction by B lactamatases. So we have our chart with the cephalosporins. So we have our first generation cephalosporins like cefazolin, cefadroxil, and cephalexin. You can see all the different dosage forms as well. Second generation, cefaclor, cefuroxamine. Third generation, cefiximine, cefotriaxone. And then of course our fourth generation, cefepimine, which is available only as an injection. Fluoroquinolones are indicated for the treatment of UTIs, sinusitis, STIs, bacterial conjunctivitis, infectious diarrhea, anthrax, and numerous other infections. A common ending of fluoroquinolones is floxacin. Fluoroquinolones inhibit the enzyme DNA gyrase that is responsible for blocking one of the processes of DNA replication. This results in the inhibition of bacterial DNA synthesis. Fluoroquinolones are formulated for oral, ophthalmic, and parenteral use. Oral absorption is good. The half-life of the newer agents, such as moxifloxacin, is long, permitting once daily dosing, whereas ciprofloxacin is dosed every 12 hours. So we have our fluoroquinolones. You can see ciprofloxacin. We have many different dosage forms and brand names. Factive only has one strength of tablet. Zymar and Zymaxid are ophthalmic solutions, which we talked about in chapter 15. Levofloxacin, which is Levaquin in the US too. And we have all of these different dosage strengths. And we have moxifloxacin, ofloxacin, and norfloxacin, which is not available in the US. So I shouldn't have said that. Azithromycin, clarithromycin, and erythromycin are macrolide antibiotics that are primarily used for the treatment of URIs. Other important uses are the treatment of peptic ulcer disease, eye infections, and acne. Erythromycin, the prototype for the macrolides, is used for the prevention of neonatal eye infections and acne, in addition to treatment of upper respiratory infections. Clarithromycin is one of the ingredients in multi-drug treatment regimens for PUD caused by the bacterium H. pylori, which we talked about in chapter 21. Macrolides are formulated for oral, parenteral, and ophthalmic use. Erythromycin base is formulated for immediate release and delayed release. The expiration date of powder for the oral suspension of erythromycin, clarithromycin, and azithromycin is shortened once the drug is reconstituted. And then we have our chart here for azithromycin. We have azosite, which is the ophthalmic solution, and then Zithromax, which is all the rest of these. So we have the powder for injection, the powder for oral suspension, and the tablet. And this is the Z-Pak. A Z-Pak is a zithromycin, if you've ever taken one. Clarithromycin, like Biaxin and Biaxin XL, comes in suspension and tablet and extended release tablet. Erythromycin base, we have a few different dosage forms: topical gel, ophthalmic ointment, a tablet, swabs, and a topical solution. Then we have some other formulations of erythromycin. Linzolide is a newer antimicrobial agent indicated for the treatment of gram-positive bacterial pneumonia and skin structure infections. Its use is limited because of adverse side effects and to limit the development of bacterial resistance. The metabolism of linzolide is not well understood. Linzolide has no effect on cytochrome P450, so it has fewer drug interactions involving drug metabolism. So the brand name is Zyvox. Penicillin is one of the first antibiotics discovered. It is a naturally occurring substance originally produced by the mold Penicillium and can grow on stale bread and fruit. Oral penicillins are used to treat many infections, including URIs, otitis media, skin infections, strep throat, and to prevent recurrent rheumatic fever. Penicillins may be administered before dental and other medical procedures to prevent bacterial endocarditis in individuals with prosthetic heart valves. Parenteral penicillins are used for the treatment of numerous infections, including bone and joint infections, diabetic foot ulcers, infectious arthritis, sexually transmitted infections, meningitis, and septicemia. A common ending for the penicillin family of drugs is -cillin. Persons who are allergic to penicillin can also be allergic to cephalosporin. So when you're entering a prescription for somebody who's allergic to penicillin and it's for, let's say, the cephalosporin Keplex, it's more than likely going to generate a DUE, a drug utilization evaluation, for the pharmacist to review. And then they will just ask the patient if they've ever taken a cephalosporin and to watch their side effects. Penicillins are B-lactam antibiotics. They inhibit the synthesis of the cell wall of sensitive microbes. Carbapenems have a B-lactam ring infused with a penem ring. Many penicillins lack stability in gastric acids, which is why most are administered intramuscularly or must be taken on an empty stomach. The exception is penicillin VK, which is relatively acid stable, and that's the tablet we have in the pharmacy. Penicillins that are formulated as powder for reconstitution have shortened expiration dates once mixed with water. They range from 10 to 14 days, depending on the drugs, and they should be refrigerated after they're reconstituted. So we have our chart of penicillins, all the different dosage forms. So you see amoxicillin, a very popular one, has quite a few. Carbapenems, we have all of these drugs: meropenem, atropenem, meropenem, and vabobactam, Vabomere. Sulfonamides are the oldest antimicrobial agents. They're commonly called sulfa drugs because the generic name of all agents begins with sulf. Sulfonamides and trimethoprim are used in the treatment of various upper respiratory, urinary tract, and skin infections. They are also indicated for the treatment of AIDS-related pneumonia. Sulfonamides and trimethoprim are antifolate drugs. They interfere with microbial synthesis of folic acid at separate steps in the biosynthetic pathway that ultimately leads to bacterial DNA synthesis. Food may slightly decrease the absorption of sulfonamides. However, the drug may be taken with small amounts of food to reduce GI upset. The warning label, "take with lots of water," is put on prescription vials for sulfonamides. This reduces the risk of kidney damage caused by crystalluria. We have our chart with sulfonamides, sulfadiazine, and then combination sulfonamides like sulfamethoxazole and trimethoprim. And see all the different dosage strengths and forms. Tetracyclines are broad spectrum antibiotics. They may be bactericidal or bacteriostatic. They are used for the treatment of acne, sexually transmitted infections such as chlamydia, Lyme disease, and Rocky Mountain spotted fever. A common ending for the tetracycline family of drugs is cycline. Tetracycline inhibits bacterial protein synthesis. Doxycycline and minocycline are more stable in the acidic stomach contents than tetracycline. They also have a longer duration of action. They're given once or twice daily, compared with tetracycline, which is given 4 times daily. Tetracycline interacts with dairy products, calcium, aluminum, and ferrous supplements to form a chelated complex. The complex significantly reduces the absorption of tetracycline and should be avoided. Apply the following warning label to prescription vials for tetracycline. Avoid tanning and prolonged exposure to sunlight. And then we have our chart with them on here. Isoniazid is used for the treatment of tuberculosis. It inhibits the synthesis of mycolic acid, an important constituent of the highly lipid cell wall of mycobacteria. Isoniazid may cause liver disease and nerve damage. Concurrent administration of vitamin B6 is recommended to prevent neurotoxicity. Metronidazole is an amoebicide. It destroys the protozoa that causes giardias, traveler's diarrhea, and trichomoniasis, a sexually transmitted infection. It is a drug of choice for the treatment of C. diff and enteritis, a condition that may cause pseudomembranous colitis. Topical preparations are used for the treatment of acne rosacea. It is formulated for oral, parenteral, vaginal, and topical use. Alcoholic beverages or medicines containing high levels of alcohol may produce nausea, vomiting, stomach pains, headache, and dizziness. The drug may also produce a metallic taste. Mupirocin is a topically applied antimicrobial used to treat staphylococcal infections of the skin, such as impetigo. Clindamycin is an antimicrobial agent used topically for the treatment of acne and vaginosis. Systemic use of clindamycin is associated with the development of C. diff, a bacteria that causes diarrhea and pseudomembranous colitis. Drinking plenty of fluids can lower the risk of development of this condition. So we have our miscellaneous antibacterial agents. You can see all the different ones for metronidazole, clindamycin, tons. All right, now we have our summary of drugs used for the treatment of bacterial infections. We went over all these, but we're going to go over the warning labels. So, of course, for all of them, to reduce microbial resistance, we want to complete the full course of therapy. Cefadroxil, we want to take with food. Refrigerate and shake well for all suspensions. For the fluoroquinolones, we're going to take with lots of water, avoid prolonged exposure to sunlight, may cause dizziness or drowsiness, avoid antacids and vitamins containing iron and zinc. We're going to shake our suspensions well, of course, swallow whole, do not crush or chew, extended release, and take on an empty stomach. For the macrolides, we have just a little note, the azithromycin, which I said the Zithromax is the Z-Pat, and it has the directions here. 500 milligrams for day 1, followed by 250 milligrams once daily for 4 days. So they take 2 tablets of the 250 milligram on day 1, and then they take 1 daily for the remaining 4 days. So it's a 5-day supply, and we dispense 6 tablets. Erythromycin, clarithromycin and zithromycin may decrease the effectiveness of oral contraceptives. For the sulfonamide and sulfonamide combinations like sulfamethoxazole and trimethoprim, those should be taken with plenty of water, avoid prolonged sunlight. The penicillins, complete full course of therapy. Ampicillin, clozaxilin, and dicloacillin should all be taken on an empty stomach. These can decrease the effectiveness of oral contraceptives. Amoxicillin is one of the biggest ones. Refrigerate, shake well, and discard after 10 days. The amoxicillin and clavulanic acid suspension. For the tetracyclines, complete full course of therapy. Avoid prolonged sunlight. Avoid antacids and vitamins containing iron and zinc. May decrease effectiveness of oral contraceptives. Take on an empty stomach for tetracycline and shake well for the suspensions. For metronidazole, avoid alcohol. That's a huge one. Take with a full glass of water. Isoniazid, avoid antacids and alcohol. Ibuprofen, it is this one they're talking about is an ointment that can be given for skin conditions or intranasal infections. These are antibiotics. They should still be taken and completed like regular antibiotics. We're going to complete the full course of therapy.